Hi, my name is David Bruno, and I'm currently 28 years old. My overall experience with the Medical Health Institute and his team has been very positive. They're extremely knowledgeable. They were openly able to answer all of my questions when doing the consultations. I didn't feel pressured nor rushed. Um, I would say, what would I say to someone considering hormone replacement therapy? It would be along the lines of start by taking action. You know, if you want to improve in your life, you want to have a better quality of life, it starts with you, right? So, getting a good blood panel done, seeing where all your params and hormones are, and your vitamin levels and nutrients and stuff where we're at, see if anything's out of whack. Second, it starts with getting a consultation. Sit down with a one on one, very knowledgeable person who knows what to look for and how to go over your blood panel report and also give you feedback, which these guys, I personally have, vetted myself, Dr. Everyone. I had my own questions lined up. I'm a very data oriented, self learner. So I already done my research. I had my questions ready to go during my consultation and he was able to openly answer all of them, and I felt very confident in him and his practice. How quickly did I start to feel results when started therapy? So my situation is a little bit more complex. Me coming to them when I was 27, I was proposed with going the route of peptides first, working with the body's natural production system to ramp up the production and see how the body responds. And that entails you doing cycles on, cycles off, because you can't do it for weeks on end with peptides doing with these specific things. And so I would do cycles and then do another blood panel and then see where my results are and how well my body's responding. And of course, I significantly improved in mood and energy and stuff. But once I came off, it kind of bounced down a little bit. So after a few months of trying different things, finally we came to the conclusion, let's put me on TRT. Started with TRT with a very reasonable dose, administered a very reasonable amount throughout the week. And I would say that by week one, energy was improved, mood improved. Week two, most definitely recovery and strength at the gym was improving. Week three, I noticed my sleep was significantly better. Prior to this, I was having to rely on sleeping medications, over the counter stuff to help me get the rest. Now, at this point, after being on TRT for several months now, I will rarely take a melatonin, which is more of a natural supplement alternative. And so, yeah, again, as I state that just over the course of weeks, things improved. And even though I've been on this for months, it still gradually continues to improve. I really dialed in my diet. I really got my sleep much more under control, and I get more adequate quality of sleep and things of that nature, which all contribute to your experience, right? So it just comes down to you yourself. Everyone is different. What made me qualm those concerns and take the steps to getting started? Again, um, it was just a matter of me doing my own research, asking these questions, going back and forth until I was able to fully understand specific things, taking notes during the consultation, going and applying and doing additional research, and finding that, hey, these guys know their stuff. They know their stuff. They high quality treatment, high quality protocol, and it just overall contributed to the fact of me taking action and just biting the bullet. And looking back after being with them for quite some time now, it's been one of the best decisions I've ever made in my life thus far. I cannot stress this enough when I say that I've never been in such a great place. I've never been so energized. Sleep, health, fitness. Recovery time is significantly improved. Hell, even libido's tremendously increased. So all those things, yes. Was I skeptical before starting therapy, and what were some of my concerns? So yeah, of course, there's some skepticism there for the fact that, let's be real, about 2/3 of men's clinics across the nation, they all have their cookie cutter protocols. It's like a one size fits all deal, which is far from the truth, right? So they'll be like, all men get this set amount of TRT, get an AI added on, do a frequent administration of 1 to 2 times a week, which you really don't want to do 1 time a week, you know. And it really comes down to it's a vast lack of or outdated knowledge. And so in today's standards, me, I was within the range of acceptable, but I was on the very low end range of testosterone. And little did I not realize that how much that drastically affected me. Once I just increased it just a minuscule amount, not a whole lot, right? Everything improved with me. It just increased every aspect that I can stress enough, right? Um, so yeah, to wrap up again, it comes down to you taking action, do research. If you don't feel like you want to take it upon yourself to do the research, then book a consultation. Speak with someone whom has the knowledge and who has taken the time to research, which these guys have. As I previously stated, I had my assortment of things that I had to get clarified with them first before I felt comfortable proceeding with protocols and their therapy related methods. Again, why do you take your car to a mechanic, right? Because they specialize in having your automobile repaired, whereas you want to go to a men's health clinic, who specialize in men's health. But again, I want to touch on the base of, just therapy alone will not help you. It will not be one thing that you need to just solve all of your issues, right? It comes down to you taking action. You need to work on getting a good, reasonable diet. Just the word diet, it tends to intimidate a lot, but it's not necessarily as bad as you may seem to be. There are so many different things out there you can try. I focus on whole foods, a good amount of fruits, vegetables, proper supplementation, preferably organic foods. Another thing is you really want to prioritize making sure you get adequate sleep. You want a good sleep schedule. You want to get at least 7 hours a night. I'm a very go oriented person. I work multiple jobs. I have multiple side hustles going. I train frequently, 5 to 6 days a week. I go and put a minimum of 1 hour in at the gym, and that's another thing that's very important. That if you get on, HRT or TRT, that you need to take action and you need to be going to the gym. Nothing too crazy, nothing too overwhelming, but just the fact that you're putting there, you're exercising your body's utilizing and taking full advantage of the testosterone that you're now allowing yourself to have and create. You need to be working on yourself, gradually building up. And if you apply all these principles of diet with the HRT, TRT, with the sleep and the exercise, your life will completely change. And again, it comes down to you taking responsibility and taking action and following through with the choices that have been laid out for you. So that's it.